Hello friends, welcome back to the channel. Today we will learn one of the most commonly used yet most confusing topic, paracetamol dose in pediatrics. By the end of this video, you will be able to confidently calculate the correct dose for any child, whether it's drops, syrup or IV form. So let's start. So let's start with the basics. So paracetamol if we see the IV dose, it is 10 mg per kg per dose. Oral, it is 15 mg per kg per dose. And what should be the interval? It is given every 4 to 6 hours. Maximum 4 doses per day. Fine. So what is the golden formula here? That is dose in mg is equal to weight in kg into 15. This is for oral dose. Fine. But I will tell you here one of the easy shortcut trick. For example, you want to calculate the volume, that is ml, in OPD. So how you can calculate? It is very simple. That is volume in ml is equal to weight in kg into 0.3. So by this shortcut formula also you can calculate the ml. Fine. Now before going further, we will see what are the common preparations or the brands which are available. Fine. So let's see one by one. Common preparations. Why we need to know this? Because it will help us in calculating the ml and calculating the dose. Fine. So one example is Calpol 120 mg in 5 ml. Next, Calpol 250 mg in 5 ml, and in drops it is coming in 100 mg per ml. Fine. Calpol 120 mg 5 ml used for infants and small children. Then Calpol 250 per 5 ml used for older children and drops are used for less than 10 kg infants. Fine. So now we know the common preparations and the strengths which are available in the market. I have here taken Calpol. It can be any other brand also. Fine. Now let's see how we will calculate. So let's take an example. For example, there is a child and the weight is 4 kg. Fine. So what was the oral dose? It was 15 mg per kg per day. Fine. So for 4 kg it will become 4 into 15 is equal to 16 mg, and this is needed for per dose, but it is in mg, but we need in ml. So we know what are the preparations available. One is 120 mg per 5 ml, another is 250 mg per 5 ml. So in this case, for example, we are considering 120 mg 5 ml strength is available. Fine. So how we will calculate? Here we need how much? 60 mg. So we know that 120 mg is present in 5 ml. So 1 mg we can calculate by simple mathematics. For 1 mg it is 5 by 120 ml. So for 60 mg we will require how much? 5 divided by 120 into 60 ml is equal to how much it will become? 2.5. So it is 2.5 ml. So for a child having 4 kg weight, what would be the dose? It will be 2.5 ml per dose. So if we are giving TDS, so we will give 2.5 ml TDS. If we want to give 4 times daily, then we will give 2.5 ml 4 times daily. Fine. So we have to remember paracetamol dose calculation is done on per dose, not on per day. So this is one example. Fine. So let's see another example. Now for example, the baby is having weight 4 kg only. Again we are comparing weight is equal to 4 kg, but here we will see the strength of 250 mg in 5 ml. So how we will calculate, right? So again 4 into 15 is equal to 60 mg we need. Fine. So 250 mg present in 5 ml. So for 1 mg it will become 5 divided by 250. So for 60 mg it will become 5 divided by 250 into 60. So if we do the mathematics, it will come around 1.2 ml per dose. So usually for 60 mg or 4 kg baby we are going to use the strength of 120 mg per 5 ml. Fine. I have just used this 4 kg just to show you how to calculate. So first thing you have to know how much per dose you have to give, and then next thing you have to know is how much is the strength. So here if you are giving 120 mg per 5 ml strength, then it was 2.5 ml per dose, and if we are giving 250 mg per 5 ml strength, then the dose becomes 1.2 ml per dose. Fine. So here few of the points we have to remember. What are these? First of all, what is the maximum dose? So maximum daily dose is equal to 60 mg per kg per day. Fine. This you have to remember, and always avoid double formulations. Don't mix drops with syrup. Then you have to maintain the hydration, and always recheck calculations for infants. Fine. So before leaving, just I want to share age-wise dosing. Okay, so age-wise dosing, how we can do for age. For example, 6 to 12 months, we can give 2.5 ml BD to TDS. Then for 1 to 5 years, 5 ml BD to TDS. For more than 6 years, again 5 ml BD to TDS. But remember, it's always better you calculate for each child. Fine. If you found this video helpful, don't forget to like, subscribe and share it with your batchmates. This is from DopaMine, helping you make clinical medicine simple and confident. Thank you.